You may want to stay away from the sweet stuff if you want to help keep your kids healthy.
Thanks, Darcy. Well, many kids will take a bowl of candy over a bowl of vegetables any day, and it is not just because they taste better. It is essential for their survival. Babies and children are generally born preferring natural sweet taste. This sense of sweetness attracts them to their mother's milk and foods that are rich in carbohydrates, essential to growing and soothing pain. Doctors understand why adults give children food that tastes good. The concern is how much. A new study found that over half of infants and almost all toddlers consumed added sugar, mostly in flavored yogurts and fruit drinks. The problem with this, according to the American Academy of Pediatrics, the earlier a baby is introduced to added sugars, the more likely they will prefer and choose sweet foods into childhood and throughout their life. That puts kids at risk for tooth decay, obesity, heart disease, fatty liver, among other health problems. If you're confused about what a young child should be eating, here are a list of suggestions offered up by a panel of experts. Avoid giving children younger than 12 months fruit juice, even 100% fruit juice. Avoid giving children younger than 2 years old added sugar. Infants 6 months and younger need only breast milk or infant formula. Children 6 months to a year old can and should drink a small amount of plain water once solid foods are introduced. This helps get them used to the taste. Then begin adding whole milk between 12 and 24 months. Unsweetened and fortified soy milk is an option for kids who are allergic to cow's milk or lactose intolerant. So if you still have questions, work with your pediatrician to make sure kids are getting the nutrients they need. Bottom line, kids do not need added sugar, and real fruit is always healthier than fruit juice. So check food labels for signs of artificial and added sugar. The goal, help shape their life and to make healthier preferences for childhood and for their life. A survey finds 76% of Americans experience Sunday night blues. Here are a few tips to stop dreading the start of the work week. First, get organized by planning your Monday outfit. Then ease into the week with low-stress tasks like checking email. Maybe schedule a lunch break with a friend, and if you can, try moving Monday meetings to later in the week. Last, on Sundays, make time for something you enjoy, like watching your favorite TV show. Research shows being in a positive mood increases our ability to handle stress. New research that could slash the number of people getting stents or bypass surgery for coronary artery disease. A study looked at more than 5,000 people with blocked arteries but without severe symptoms like extreme pain or heart attack. It found that regularly taking medications along with lifestyle changes was just as effective at preventing heart attacks and premature deaths as the more invasive procedures. Those medications include statins, blood pressure drugs, and aspirin therapy. So those are your health headlines for today. In the studio, I'm Rosemarie Beltz, sending it back to you.
Rose, thank you. Doctors across the country are hopeful a new study will reassure parents that the HPV vaccine is safe for their kids. Only about half of kids are actually getting the HPV vaccine, which can protect them from cervical, head, and neck cancers. HPV is the human papilloma virus, and it's very common. Doctors say about 14 million people get infected every year, and now the latest research published in the Journal of Pediatrics is backing up with what other studies have already said about the vaccine's safety. Those are your health stories. So again, listen to what this doctor has to say.
The studies that were done originally were sound, and the side effects are minimal, and this vaccine is extremely safe.
Investigators reviewed reports over a 3-year period when 28 million doses of the vaccine were given. 97% of side effects were classified as non-serious and included headache, dizziness, fainting, and irritation after the shot was given. Another recent study found the vaccine can prevent 92% of HPV-related cancers.
All right.